What are the key differences between electronic health records (EHR) and electronic medical records (EMR), and how do these differences impact healthcare data exchange? Answer: Electronic health records (EHR) and electronic medical records (EMR) are both digital versions of patient records, but they differ significantly in scope, access, and functionality. HR is a comprehensive longitudinal record that contains a patient's health information across multiple providers and healthcare settings. HRS are designed to be shared across different healthcare organizations, improving coordination and continuity of care. MR, on the other hand, is typically used by individual healthcare providers and stores clinical data from that specific provider. MRS are more limited in scope and cannot be easily shared with other providers without additional systems like an HIE. Health Information Exchange. Impact on data exchange. HR facilitates data exchange because it is designed for interoperability, enabling different healthcare systems to access the information. This is crucial in enhancing care coordination, reducing duplication of tests, and improving outcomes. MR limits data sharing to within the practice and may require additional software or interfaces to communicate with external systems, making it less efficient for broader coordination. Explain the concept of Health Information Governance (HIG) and its importance in healthcare information systems. Answer: Health Information Governance (HIG) refers to the framework for managing healthcare data to ensure it is accurate, secure, accessible, and used in compliance with regulatory standards. It encompasses policies, procedures, and controls to ensure the integrity, confidentiality, and availability of health information across systems. Key components of HIG include data quality, ensuring healthcare data is accurate, complete, and timely; data security, implementing strong measures to protect patient data from unauthorized access, breaches, and loss aligned with HIPAA requirements; compliance, adhering to healthcare laws such as HITE, HIPAA, and local regulations governing the use of health data; accountability, defining roles and responsibilities within healthcare organizations to ensure proper management of information. Importance: HIG ensures that healthcare organizations can trust the data they use for decision-making. It helps reduce risks associated with breaches of data privacy, promotes operational efficiency by setting clear standards for data access and sharing. Relevant law: HIPAA Privacy Rule and Security Rule define the regulations for the protection and management of healthcare data. HITE CH Act strengthens data security requirements and provides financial incentives for adopting electronic health records and health information exchange. Dr. Roberts is a cardiologist who recently adopted an electronic health record (EHR) system. He is unsure about how to ensure that his patient data is interoperable with other healthcare providers' systems, such as hospitals and other specialists' offices. What steps should Dr. Roberts take to ensure seamless data exchange across different healthcare settings? Answer: To ensure that Dr. Roberts' HR system can exchange data with other healthcare providers, he should follow these steps. Ensure compliance with interoperability standards. Dr. Roberts should ensure that his HR system is certified for interoperability by meeting standards such as those outlined by the Office of the National Coordinator for Health Information Technology (ON). This includes standards like HL Health Level 7 and CCD Continuity of Care document, which enable seamless data exchange. Join a Health Information Exchange (HIE). Dr. Roberts should participate in a Health Information Exchange (HIE) that facilitates the secure exchange of patient information across different healthcare providers. Train staff on data sharing protocols. Dr. Roberts should provide training for his staff on how to use the system for sharing information securely. This will ensure that all patient data is transmitted according to privacy regulations like HIPAA. Use of electronic referral systems. To streamline communication between providers, Dr. Roberts should implement electronic referral systems for sending patient information, diagnostic results, and medical history to specialists or hospitals. What are the benefits and challenges associated with implementing a Health Information Exchange (HIE) in a healthcare system? Answer: Benefits of HIE: improved care coordination. HIE allows different healthcare providers to access the same patient data in real time, leading to better coordination of care and reducing duplicate tests and procedures. Increased efficiency. By reducing manual data entry and enabling quick access to patient records, HIE improves operational efficiency and reduces administrative costs. Better patient outcomes. Timely access to complete patient records helps providers make more informed decisions, improving patient care and outcomes. Challenges of HIE: privacy and security concerns. Sharing sensitive health data across systems raises concerns about data breaches and unauthorized access, interoperability issues. Different healthcare systems may use varying technologies, making it challenging to ensure seamless data exchange. Standardization efforts such as HL and CCD are critical but may not be universally adopted. Cost: establishing and maintaining an HIE infrastructure requires significant investment in technology, training, and ongoing operational costs. Discuss the lifecycle of a healthcare information system and explain how each phase contributes to the success of the system. Answer: the lifecycle of a healthcare information system includes several stages, each of which plays a critical role in ensuring the system's effectiveness. Planning: during this phase, the requirements of the healthcare organization are assessed. Key stakeholders, clinicians, administrators, IT staff determine the specific needs of the system, such as data management, integration with existing systems, and user access. Design and development: the system architecture is created based on the requirements identified in the planning phase. Implementation: this phase involves installing the system, integrating it with existing technologies, and training users. Testing is conducted to ensure that the system functions as intended and meets the organization's needs. Optimization: after the system is implemented, ongoing adjustments are made to optimize its performance. This may include updates, bug fixes, and tweaks to the system configuration based on feedback from users. Evaluation: in this final phase, the system's performance is assessed to ensure it is meeting the desired outcomes, e.g., improving patient care, reducing costs. Explain the concept of data stewardship in healthcare and its role in ensuring the integrity of health information. Answer: data stewardship in healthcare refers to the responsible management and oversight of health data throughout its life cycle. The data steward's role is to ensure that healthcare data is accurate, accessible, secure, and used in compliance with relevant laws and regulations. Key responsibilities of data stewards: data quality, ensuring data is accurate, complete, and timely. Data stewards must regularly audit and clean data to maintain its reliability. Data security, implementing security measures to protect sensitive health information in compliance with HIPAA and other privacy laws. Data access control, ensuring that only authorized individuals can access sensitive health information and maintaining clear records of who accessed the data. Data stewardship is critical to maintaining the integrity of health information systems and ensuring compliance with regulations like HIPAA and HITE-CH. How does predictive analytics help in improving healthcare decision-making, and what are the ethical considerations? Answer: predictive analytics uses historical healthcare data to forecast future outcomes, helping healthcare providers make more informed decisions. It involves the use of algorithms and machine learning models to predict patient outcomes such as disease progression, remission risks, or treatment effectiveness. Benefits: improved patient care. Predictive analytics helps providers identify high-risk patients early, enabling timely interventions and personalized care plans. Cost efficiency: by predicting patient needs, healthcare organizations can allocate resources more effectively, reducing unnecessary tests and hospital readmissions. Ethical considerations: bias in data. Predictive models may reflect biases in the data used to train them, leading to inequities in healthcare delivery. Data privacy. Using predictive analytics involves analyzing large datasets, which raises concerns about how patient data is handled and protected under HIPAA. Transparency. Patients should be informed about how their data is being used, and there must be transparency in how predictive models are developed and applied. What is the role of an EHR in improving the quality of care for patients with chronic conditions? Answer: electronic health records play a crucial role in managing patients with chronic conditions by providing a centralized, accessible record of patient data, which supports better care coordination and clinical decision-making. Key roles of EHR in chronic care: real-time data access. EHRs allow healthcare providers to access a patient's complete health history, including lab results, medication lists, and previous treatments, ensuring informed decision-making. Care coordination. EHRs enable seamless communication between primary care physicians, specialists, and other healthcare providers involved in managing chronic conditions, reducing errors and improving outcomes. Patient engagement. EHRs facilitate patient access to their own health records, encouraging active participation in their treatment plans and promoting self-management of chronic diseases. By improving data availability and communication, EHRs contribute to better management of chronic conditions, leading to improved patient outcomes. How can healthcare organizations use data analytics to improve operational efficiency? Answer: healthcare organizations can leverage data analytics to enhance operational efficiency in several ways. Predictive analytics for resource management. By analyzing historical data, healthcare organizations can predict patient volumes and resource needs, enabling better staff scheduling and equipment allocation. Process optimization. Data analytics can identify inefficiencies in clinical workflows, such as bottlenecks in patient flow or unnecessary administrative tasks, allowing organizations to streamline processes. Cost management. By analyzing spending patterns, healthcare organizations can identify areas where costs can be reduced, such as overuse of tests or treatments, and focus on high-value care. Data analytics improves overall efficiency by enhancing decision-making, reducing waste, and optimizing resource use. Discuss the challenges and strategies for ensuring data privacy and security in health information exchange. High. Answer: challenges in ensuring data privacy and security in high. Data breaches. The exchange of health information increases the risk of unauthorized access and breaches, particularly if security protocols are not rigorously followed. Interoperability. Different organizations may use different technologies, making it challenging to ensure that data is securely transferred and properly protected. Compliance. Ensuring compliance with laws such as HIPAA and HITE/CH can be difficult, especially when exchanging data across jurisdictions with different regulations. Strategies for ensuring privacy and security. Use of encryption. Encrypting health data during transfer and storage to protect it from unauthorized access. The access control. Implementing strict access controls to ensure that only authorized personnel can access sensitive patient data. Regular audits and monitoring. Continuously monitoring access to health information and conducting regular security audits to detect vulnerabilities. How do clinical decision support systems, CSS, improve patient outcomes, and what are some potential challenges associated with the implementation of CDSS in clinical settings? Answer: CDSS enhance patient outcomes by providing evidence-based recommendations, alerts, reminders, and diagnostic support to healthcare professionals. These systems help reduce diagnostic errors, improve the consistency of clinical decisions, and assist in following evidence-based guidelines, which ultimately leads to better patient care. By integrating with electronic health records, they provide real-time data, ensuring timely interventions. However, challenges include clinician resistance due to the perceived complexity of the system, the risk of alert fatigue where clinicians ignore warnings due to overuse, and the need for proper training and system integration. Moreover, ensuring data privacy and security is crucial to avoid breaches and protect patient information. Legal and regulatory standards such as HIPAA, Health Insurance Portability and Accountability Act need to be followed to ensure compliance with privacy laws. Explain how the computerized physician order entry (CPO) system reduces medication errors and improves patient safety. What are some of the common limitations or risks of CPOE systems? Answer: CPOE allows physicians to directly input medication orders into the system, reducing errors associated with handwriting and transcription. By integrating medication order entry with decision support tools, CPOE can flag potential drug interactions, allergies, or incorrect dosages, thereby improving patient safety. This reduces medication errors, a significant contributor to adverse events in healthcare. However, common risks include alert fatigue when physicians ignore repeated warnings, the possibility of system glitches or downtime, and improper system configurations leading to missed or incorrect alerts. Additionally, reliance on CPOE can sometimes lead to a loss of critical thinking skills, as clinicians may overly depend on the system's alerts without conducting a full clinical review. To mitigate these issues, systems should be continually updated and user training should be emphasized. Mr. Davis is the project manager overseeing the implementation of a new HR system at a large hospital. The project has already faced delays due to lack of communication between the IT team and the clinical staff. The project is now at risk of missing key milestones, and stakeholders are becoming frustrated. As the project manager, what steps should Mr. Davis take to manage these challenges and ensure the project's success? Answer: Mr. Davis should first focus on effective stakeholder management. He must facilitate transparent communication between all stakeholders, including clinicians, IT teams, administrators, and vendors, to address the underlying issues. Organizing a series of meetings to clarify roles, address concerns, and establish clear project goals would help reset expectations. Additionally, applying risk management techniques is essential. Mr. Davis should identify potential risks, such as further delays or budget overruns, and devise mitigation strategies. For example, assigning more resources to the clinical staff's training or providing additional support to the IT team may be necessary to avoid further disruptions. Finally, Mr. Davis should ensure that proper project management methodologies, such as Agile or Lean Six Sigma, are used to streamline the project execution. Agile, in particular, could be effective here as it allows for iterative improvements and regular feedback loops. How does the integration of clinical data, such as lab results and radiology images, into a centralized electronic health record system improve care coordination? What are some of the challenges in integrating these data sources? Answer: integrating clinical data into a centralized EHR system improves care coordination by ensuring that all healthcare providers have access to the same up-to-date patient information such as lab results, radiology images, and medical histories. This centralized data sharing helps eliminate duplicate tests, reduces delays in care, and ensures that clinical decisions are based on comprehensive and accurate information. However, challenges include interoperability issues between different systems, data standards such as ASURE-CDA not being consistently followed, and concerns regarding the security and privacy of sensitive data. Additionally, clinician training is essential to ensure that the integrated systems are used effectively and that workflows are not disrupted by the changes. How do evidence-based medicine and clinical guidelines influence the design of clinical decision support systems, CUSS? Provide examples of how the integration of these practices can impact clinical outcomes. Answer: evidence-based medicine and clinical guidelines provide the foundation for designing CDSS, ensuring that the recommendations and alerts within the system are based on the latest and most valid clinical research. These systems can suggest treatment plans, medications, and diagnostic procedures that align with best practices and evidence from clinical studies. The integration of BM and clinical guidelines into CDSS can improve clinical outcomes by standardizing care, reducing variability in treatment decisions, and minimizing human error. For example, a CDSS might alert a clinician about an appropriate antibiotic for a patient with an infection based on the latest research, reducing the likelihood of ineffective treatment or antibiotic resistance. What are the key components of a risk management plan in healthcare IT projects? How should project managers identify, assess, and mitigate risks throughout the project lifecycle? Answer: a comprehensive risk management plan includes the following key components. Risk identification. This involves identifying potential risks that could affect the project, such as delays, cost overruns, technical failures, or resistance from stakeholders. Risk assessment. Once risks are identified, they must be assessed in terms of their likelihood and potential impact on the project. This step helps prioritize which risks need immediate attention. Risk mitigation. After assessing risks, the project manager should develop mitigation strategies. This could include adding contingency resources, setting up additional training sessions, or adjusting the project timeline. Throughout the project lifecycle, the project manager must continuously monitor risks, reassess them as the project evolves, and implement mitigation measures as needed. An effective communication plan ensures that stakeholders are aware of risks and their mitigation strategies. What is the role of effective stakeholder management in the success of healthcare IT projects? How can communication strategies be designed to engage clinicians, IT teams, and other stakeholders? Answer: stakeholder management is crucial in healthcare IT projects as it helps align the interests and expectations of different parties, ensuring smooth project execution. By involving clinicians, IT teams, and administrators early in the planning process, the project manager can ensure that all parties understand the project's goals, timelines, and deliverables. Communication strategies should include regular updates, clear documentation of project milestones, and feedback loops to address concerns. Engaging clinicians through training sessions, focus groups, or pilot tests can ensure that the system meets their needs and improves clinical workflows. IT teams should be regularly informed about any changes in clinical requirements or feedback to ensure that technical requirements align with user needs. MS Thompson is managing a healthcare IT project aimed at integrating a new HR system in a multi-site hospital network. The project has encountered significant risks, including scope creep due to changing requirements from different departments and potential delays due to under-resourced IT teams. What actions should MS Thompson take to address these risks? Answer: to address scope creep, MS Thompson should review the original project scope and work closely with department heads to clarify and prioritize requirements. She should ensure that any changes to the scope are formally documented and reviewed to assess their impact on the project's timeline and budget. To manage the resource constraints of the IT team, MS Thompson could consider reassigning tasks, hiring temporary support, or extending deadlines to allow the team more time to complete essential tasks. Regular progress meetings with the IT team and other stakeholders will help identify any potential bottlenecks early on and ensure timely intervention. Lastly, MS Thompson should revise the project's risk management plan, incorporating these new risks, and develop clear mitigation strategies to prevent further delays or scope changes. What is the importance of quality assurance in healthcare IT projects, and what testing methodologies are commonly used to ensure the delivered system meets the required specifications? Answer: quality assurance is essential in healthcare IT projects because it ensures that the final product meets the required functionality, security, and usability standards. QA helps to identify defects or issues early in the development process, reducing the risk of failure after implementation. Common testing methodologies include unit testing, testing individual components for functionality, system testing, ensuring that the system as a whole meets specifications and integrates well with other components, user acceptance testing, end users test the system to ensure it meets their needs and expectations, integration testing, verifying that the system works seamlessly with other systems, e.g. lab systems, billing systems. These tests help ensure that the system is safe, reliable, and functional before it is deployed in a clinical environment. What are the key regulations governing the privacy and security of clinical data in healthcare IT systems? How should healthcare organizations ensure compliance with these regulations? Answer: key regulations include HIPAA, Health Insurance Portability and Accountability Act, ensures the privacy and security of patient data by setting standards for the handling, storage, and transmission of health information. HIT Health Information Technology for Economic and Clinical Health Act promotes the adoption of electronic health records and health information technology while enhancing privacy protections. Healthcare organizations must implement robust security measures, including encryption, access controls, and regular security audits. Staff training is also critical to ensure compliance with data privacy laws. Organizations should also have policies for responding to data breaches as required by HIPAA and HIT-CH. What are the key differences between electronic health records (ER) and electronic medical records (EMA)? How do these differences impact healthcare organizations' decision-making in terms of system selection and integration? Answer: the key difference between HR and EMR lies in their scope and interoperability. HR refers to a comprehensive digital record of a patient's medical history, which can be shared across multiple healthcare providers, enhancing coordination of care. HRS are designed for use by providers across more than one healthcare organization, e.g. hospitals, specialists, etc., promoting information exchange. EMR, on the other hand, is confined to a single provider or healthcare organization. It's primarily used for the internal management of patient data within a practice or hospital. These differences impact the decision-making process for healthcare organizations aiming for collaborative care across different providers. HR is more suitable due to its interoperability and ability to share data. The MR is generally selected by single provider organizations as it's less expensive and simpler but lacks the capability to share data with external providers, limiting the scope of care coordination. Healthcare organizations must consider their operational needs and goals for patient data exchange when choosing between the two. What are the key privacy and security requirements that healthcare organizations must consider when implementing an electronic health record system? Discuss the relevant laws and regulations that govern these requirements. Answer: when implementing HR systems, healthcare organizations must comply with the Health Insurance Portability and Accountability Act (HIPAA) regulations, specifically the Privacy Rule and Security Rule, to protect patient information. Key privacy and security requirements include data encryption ensures that patient data is encrypted both at rest and in transit, preventing unauthorized access during storage and transfer. Access controls. Implementation of strong authentication methods and role-based access to limit data access based on the user's role and need-to-know basis. Audit trails. Maintaining comprehensive logs of all system interactions and changes to monitor and detect unauthorized access or breaches. Data backup and disaster recovery. Systems should include backup mechanisms to ensure data availability and integrity in case of system failures. HIPAA ensures that healthcare organizations must take adequate steps to safeguard electronic health information from unauthorized access, loss, or corruption. Dr. Smith has recently decided to implement HR system in his practice. After selecting a vendor and completing the system design, he now faces challenges in staff training and system optimization. Despite the system being operational, there are issues with its integration into daily workflows, and some clinicians are reluctant to fully use the new system. What should Dr. Smith do to optimize the HR system and ensure better integration with the practice's workflows? Answer: Dr. Smith should take the following actions. Workforce engagement and training. Dr. Smith should provide comprehensive, role-specific training to clinicians, ensuring that they understand how the HR can benefit their practice. This includes focusing on the ease of use and efficiency improvements, workflow integration, work with the HR consultant or expert to tailor the system to the practice's workflow. Optimization should involve streamlining processes such as order entry, charting, and prescription management to minimize disruptions. Feedback and continuous improvement. Set up a feedback loop where clinicians and staff can report difficulties and suggest improvements. Implement a phased approach to adoption, allowing staff to adapt gradually. Incentives and support. Offer incentives for early adopters and provide ongoing technical support to address issues promptly. Establish a dedicated support team to assist with troubleshooting and resolve system issues quickly by addressing training, workflow integration, and ongoing support. Dr. Smith can optimize the system to meet the practice's needs and increase user adoption. How does predictive analytics contribute to improving patient outcomes in healthcare? Provide examples of its application and discuss its impact on decision-making and resource allocation. Answer: Predictive analytics uses historical data, statistical algorithms, and machine learning techniques to forecast future events, helping healthcare organizations anticipate patient needs and improve care delivery. In healthcare, predictive analytics contributes in several ways. Patient risk stratification. By analyzing patient history, predictive models can identify individuals at high risk for chronic diseases, remissions, or complications, enabling early intervention. Resource allocation. Predictive analytics can forecast demand for hospital beds, staffing requirements, and medical supplies, improving operational efficiency and reducing costs. Personalized care plans. Data-driven insights allow clinicians to create tailored treatment plans that are more likely to lead to favorable patient outcomes. For instance, predictive analytics can be used to predict which patients are at risk of being remitted to the hospital, enabling healthcare providers to implement preventive measures such as targeted follow-ups or interventions. Explain the role of interoperability in the functionality of electronic health records (EHR). Why is it essential for healthcare providers to have HR systems that can exchange data with other providers? Answer: Interoperability refers to the ability of different healthcare systems, e.g., laboratory systems, pharmacy systems, to communicate and exchange data effectively. This is essential for several reasons. Continuity of care. Interoperable HR systems enable patient data to be shared seamlessly across different healthcare providers, e.g., specialists, hospitals, primary care, ensuring that all clinicians have access to the most up-to-date information, improving care coordination and patient outcomes, reducing errors. When patient data is shared accurately between providers, it reduces the risk of errors such as duplicate testing, misdiagnoses, and medication interactions. Regulatory compliance. Interoperability is mandated by initiatives such as the 21st Century Cures Act in the U.S., which emphasizes the need for HR systems to be able to share patient data efficiently and securely, ensuring better patient care. Having interoperable systems enhances patient safety, reduces healthcare costs, and improves clinical decision-making. How can prescriptive analytics be used in healthcare decision-making, and what are its benefits for healthcare administrators? Answer: Prescriptive analytics goes beyond predictive models by recommending specific actions or strategies to optimize outcomes. In healthcare, prescriptive analytics can optimize treatment plans. By analyzing treatment patterns and patient outcomes, prescriptive analytics can recommend the most effective treatments or interventions based on patient characteristics and clinical history. Improve operational efficiency. Healthcare administrators can use prescriptive analytics to streamline operations, such as optimizing staffing schedules or identifying cost-saving measures in supply chain management. Enhance patient flow. By analyzing patient admission patterns and discharge times, prescriptive analytics can recommend adjustments to hospital operations to reduce bottlenecks and improve patient throughput. The use of prescriptive analytics provides healthcare administrators with actionable insights, allowing them to make data-driven decisions that improve both clinical outcomes and operational efficiency. Sarah, a healthcare administrator, has just been notified that an employee inadvertently accessed a patient's EHR without proper authorization. The patient's data was not leaked, but the system logs clearly show unauthorized access. Sarah needs to respond according to HIPAA compliance requirements. What steps should she take to address the situation? Answer: Sarah should take the following steps. Report the incident. Sarah must immediately report the incident to the compliance officer and document the breach. Under HIPAA, any unauthorized access must be reported. Investigate the breach. Investigate whether the employee had a legitimate reason to access the record. If not, disciplinary action may be warranted. Notification. If necessary, notify the affected patient about the unauthorized access to their information in compliance with HIPAA's breach notification requirements. Conduct a risk assessment. Sarah should assess the potential risk of harm from the breach even though no data was leaked. This will help determine if further mitigation steps are needed. Implement corrective actions. Review and enhance internal security protocols, such as access controls and audit trails, to prevent similar breaches in the future. By following these steps, Sarah ensures that the organization remains compliant with HIPAA regulations and addresses the breach effectively. What role does data visualization play in healthcare analytics, and how can it enhance decision-making for both clinicians and administrators? Answer: Data visualization plays a critical role in transforming complex healthcare data into understandable and actionable insights. It helps clinicians and administrators to monitor key performance indicators. KPIs, dashboards, and visual reports allow healthcare administrators to track KPIs like patient wait times, readmission rates, and treatment effectiveness in real time. Identify trends. Data visualization tools like heat maps, scatter plots, and line charts help in identifying emerging trends in patient outcomes, disease outbreaks, or operational inefficiencies. Facilitate communication. Visual representations of data can communicate insights more effectively to non-technical stakeholders, such as hospital boards or patients, making complex data more accessible. Tools like Tableau and Power BI are commonly used in healthcare to create interactive dashboards, enabling healthcare professionals to make quicker, more informed decisions. Compare and contrast the use of Tableau and SAS as business intelligence tools in healthcare. Which tool would be more suitable for predictive analytics, and why? Answer: Tableau. Tableau is primarily a data visualization tool that excels at creating interactive, user-friendly dashboards. It is suitable for healthcare organizations looking to present data in an intuitive format, enabling decision-makers to quickly spot trends and outliers. However, its predictive analytics capabilities are limited compared to SAS. SAS is a comprehensive analytics platform that excels in predictive analytics, statistical modeling, and advanced analytics. It provides more robust tools for forecasting patient outcomes, analyzing large datasets, and building predictive models. SAS is better suited for healthcare organizations focusing on data mining and predictive modeling. For predictive analytics, SAS would be the more suitable tool as it provides a wider range of advanced statistical techniques and machine learning algorithms necessary for healthcare predictive modeling. What are the key challenges and strategies that healthcare organizations must consider when transitioning from paper-based records to electronic health records? Answer: The transition from paper-based records to EHR presents several challenges. Data migration, converting paper records into digital formats, requires significant effort. This involves scanning, data entry, and validation to ensure the accuracy and completeness of patient information. Staff training. Healthcare staff must be trained to use the new system, which can initially slow down productivity and create resistance among employees. Workflow disruptions. Shifting from manual paper processes to digital systems can disrupt established workflows. Organizations must adapt workflows to integrate the HR system without sacrificing care quality. Strategies to overcome these challenges include phased implementation. Implement the system in phases, starting with less critical functions and gradually expanding its use. Comprehensive training programs. Provide ongoing training and support to help staff adapt to the new system. Data validation and quality assurance. Ensure that data is accurately migrated and validated during the transition, preventing errors and ensuring completeness.